Hello everyone, good afternoon. Sure you're having a good Saturday. Welcome to Safe Space with Pastor Wale Afelumo. It's good to have you on board for our second edition. Today we'll be talking about a topic that I know not many Nigerians like to talk about. The College of Medicine, University of Ibadan says that in every year, about 1.5 million cases of anxiety disorders are diagnosed. So it shows that Nigerians are dealing with this and we really don't like to talk about it. Now, my guest today will be talking under anonymity, so we'll be watching her on video. She'll be telling us her experience with anxiety disorder and how she came out of that. I believe that somebody will learn something today, somebody will hear something that they can work with and be able to also help a friend. I will encourage you to call your friends and family members to be a part of this experience today. It's going to be an experience you will live to remember. At the end of the video, I'll bring in my second guest, a medical practitioner that you should be familiar with. They will help us to unpack this whole topic, and then we'll talk about it. Then you can ask your questions and I'll tell you a little more about that later. Today, we'll be talking about unmasking anxiety. Watch our story and we'll be right back.
In 2016, I was pregnant for my third child, and then I started having preterm contractions, so I was placed on bed rests. I stayed at a hospital for like 6 to 8 weeks, in and out. And during that time, I saw a lot of things. You know, when you're in a hospital environment, you see people come in, you see people leave, you see people come in, you see people leave to the mortuary. I just saw a lot in the hospital, and at that time, I didn't know those things were having an effect on me. And then one morning I woke up and I just felt my baby wasn't moving. I wasn't really due, but I just couldn't feel my baby moving. So I started complaining. They connected me to all the machines, monitors, and all the doctors were telling me that the baby was fine. But I didn't believe them, because to me, the baby wasn't moving. That was an active baby, and suddenly the baby wasn't moving. So I was really scared. And then the next morning, they had to do a C-section, and I had the baby. After the C-section, I was in the hospital for normal 3 days. And on the morning I was about to be discharged, I was really happy I was going home. And then the nurse now took my vitals, and then she was just leaving, and she said, Madam, I hope you don't come down with postpartum eclampsia, because the way your blood pressure is climbing, I'm not very comfortable with it. So the moment she left my room, I picked up my phone and I went to Google to check what is postpartum eclampsia. And then I saw all the things that it meant, and I really got scared. I got home and I was a bit concerned that a medical person had told me I might be having postpartum eclampsia. So personally, I think I started looking for the signs and symptoms of it, and things started climbing from that point. 1 week later, I was back at the hospital for post-check, after surgery and all check. And the doctor checked me and said, you're doing good. Of course, my blood pressure was slightly elevated, but in my mind at that time, my BP was high. And even when they told me, it's okay, it's normal to come down, you have 12 weeks, 6 weeks, and everything will be back to normal. In my mind, I was already afraid. So anyways, I took my baby, and just before I left, the doctor said, I think you should go to pediatrics and let them take a look at your child. I didn't go there for the child, I was there for myself. So when they said, take your child, so I went to pediatrics, and then they looked at the baby, and then they said, they had to do some blood work and all that. And then they gave me, boom, your baby's blood level is low, is below normal. We have to transfuse, we have to take the baby to ICU. And I was wondering, how did I get here? I just came with my baby and I came for checkup, and now baby is going on admission. I had to call my husband from work, come and donate blood. And then the cycle started. My baby was in ICU. I had to be going to see my baby. You can't hold the children, you can't really feed, you can't do much. And while I was there, Because it was a hospital I had been for so long, I was able to go to the nurses and say, please, I'm having this headache, can you check my blood pressure? And they did, and of course it was high at that point. So they placed me on medication. I stayed in that hospital. When my child got better, we got discharged and went home. But I had to be going back for follow-up on this child because his blood level was still low. Now, he was placed on injections, he was placed on medications, and we battled this thing for 12 weeks, plus or minus 12 weeks. And through it, now that means from pregnancy to childbirth to 12 weeks later, it was just back-to-back hospital for one thing or another. And at that point, I just knew my blood pressure was just all over the place. I was afraid. I couldn't understand what was really going on with the baby. I just knew I was scared. Now, by the time my baby got better, I was now always having one issue or the other to take me back to the hospital. And then at home, I would now, maybe if my baby is crying and somebody else is holding the baby, somewhere in my mind, you're not doing something right and something is going wrong, and then I would snap. So I was lashing out at everybody. I'll call my husband from work and tell him, I can't breathe, I can't breathe, I can't breathe. We'll rush to the hospital, they'll check, nothing. We'll be in church and I'll tell him, I don't know how I'm feeling. I really don't know how I'm feeling right now. I'm feeling dizzy. It's as if I want to fall. There's something wrong with me. There's something wrong with me. And he will just carry me. Let's go to the hospital. They will check, nothing. And then this thing continued the whole of 2016. 2017, I resumed work. My job was suffering. My boss was complaining. I'll get to the office and I will just panic. I'll feel like I can't breathe. I'll just get into my car, drive to the hospital. I'll always be checking my pulse. I'll hold my hand, I'll count how many, I'll go on Google, how many is normal, how many is abnormal, is anything happening to me? And it was just like that. You know, I got to the point where when I'm in the hospital, nobody even takes me seriously. Like, I was like a joke in my mind. If I get there, the doctor will just say, okay, they'll give you paracetamol, give you vitamin C, tell you to go home. And I can't count how many ECGs I did. I can't count. So this continued till late 2017. And then because I had been going to the hospital so much, I had some doctors that actually became my friends, and then they introduced me to a cardiologist. So when I met the cardiologist, he looked at me and then he spoke to me. He told me there was nothing cardio-wise wrong with me. I was not a heart attack patient, I was not a stroke patient, I didn't have the risk factors and all that. But just keep my mind at peace, he decided that I should do a long list of tests, and he wrote all those tests out for me, and then I went and I did all of them. I had to do a brain CT, MRI, endoscopy, colonoscopy, all the thyroid function tests, all the blood work. You know, I just have this big collection of medical reports, x-rays, chest x-rays, scans. I did them, ECG, echo. I think I had like 3 echoes just to make sure that my heart was okay. And by the time I was done with all these tests, I had all these results saying that there was nothing wrong with me. But I just still felt something was wrong. And the doctors had not just found out what was wrong with me. They were missing something, and something was not really right with me. Sometimes I wake up at night and I can't sleep because I'm afraid that if I sleep, I'll die. And there was this voice that just kept on telling me, you will die. You will die. This one will kill you. You are dead. It's just that by the time they'll find out what's really wrong with you, it's too late. My boss had pointed it out to me because she managed, she has an NGO that manages mental health. So she had said that was postpartum depression. So when I started going to the hospital, my cardiologist said my blood pressure up and down was because of postpartum anxiety disorder, that it wasn't depression, it was anxiety, because they had to keep lowering my drugs. Because normally the blood pressure was fine. If I was panicked or I was having all those drama, it should shoot up. But once we're able to get the fear, the anxiety and all that under control, everything came back to normal. Who were most affected by this? My immediate family, my husband. Because I would call this man out of work. I would make him take me to the hospital at ungodly hours of the night. I would just whine and create tension where there's no tension. So if I didn't have a good husband that was supportive, I don't know how I would have gone through this. My children, I remember my son telling me once I was mean because I would just shout and just pour my frustration and my fear, my panic. And you always project what you have on the inside. So I would lock the gate. I wouldn't let them go out. It was just bad outside. So I would just run to their school. If I just hear something, I'll just run to their school and just pack them home. And things like this always affect relationships. And a lot of times you say things that you don't mean, but you hurt other people. During this time, I said a lot of things, and I hurt so many people that were really close to me because I didn't really know what was wrong with me. I just felt people are not understanding what I'm going through. And everybody will be looking at me like, there is nothing wrong with you. You're just losing. What is all this? I always try to have a medical person around, a friend that is a nurse, a friend that is a doctor. Somebody will just always be around so that just in case anything happens, there's somebody around. I remember my husband would want to travel and he would tell me, well, let's go together. And I even remember once I had to go to the hospital to tell the doctor that my husband wants me to travel. If I travel for 7 hours on the plane, will I have deep vein thrombosis? I went and I was asking all those kind of questions because I was so afraid. And he kept on telling me there is nothing. I was always so afraid, even at night. Sometimes I'll wake up at night and I'll just feel like I can't breathe. And I really could not breathe. I was afraid of being alone. I couldn't drive alone. I couldn't stay in the house alone. I couldn't even stay in my office. I had to call my brother, my younger brother, to move in with me. And he kind of did not have a life anymore because he had to be with me in the car when I was driving. He will be with me when I'm running to the hospital because my husband had to go to work. I'll carry him everywhere. If I'm going for school runs, he has to be in the car. If I'm going to pick the children, he's there with me. And I just could not be alone at any time because I was afraid that I was going to die or something was going to happen to me, and when it's happening, I'll be alone, there'll be nobody. Now, in one of those hospital runs, I was on admission because I was badly dehydrated, and they were trying to rehydrate me. Now, I had a roommate, a ward mate rather, an older lady, and she was also on a line with drip on. So she got up from her bed, moved her drip to my bed where I was, and she said, "Get up, get up." So I was looking at her and she said, "Get up." So I got up and then she held my hand and she started praying for me. And she said, "This is the end. You'll never come back here." She just kept on praying and praying and praying. And when she was done, she looked at me and said, "It all depends on you. You will come out of this, but it's all you. You have to make up your mind. You're too young for this. This is not you. This is not life. This is not the life. This is not your life." And she just kept on talking and talking and talking. And she kept on telling me how I needed to tell myself that I need to get out of this. It's not about the drugs. It's not because as at that time, when they had done all the tests and they didn't see anything, they now referred me to a psychiatrist who gave me lots of drugs. Now, I had mentioned that this thing was also affecting my job. And my boss also was really concerned at that time. So she had called me and she told me, she said, "Look, this thing that is wrong with you is anxiety. And when they give you drugs, if you continue on these drugs, that's what your life is going to be like. You're intelligent, you're a good person." She just kept on telling me my good part, and she said, "You can't let this thing destroy you. You can't just sit down here and allow this thing ruin your life. You need to get out of it. You need to tell yourself that this is not who you are." So my boss had spoken to me. A friend of mine that had gone through the same thing had spoken to me, and she gave me a preacher's name that should go on YouTube and listen to him and all that this is not who I am and I need to beat this thing. Now, after that day, when I got discharged from the hospital, I went home. And I sat on the floor in my living room and I brought out the envelope that had all my test results, and I just placed them on the floor, and I was praying and I was crying, and I saw the one for my head, and I said, there's nothing wrong with my head. I don't have a brain tumor. I don't have any issues. I picked up the chest x-ray. Oh, my lungs are good. I don't have any enlarged heart. I don't have this, I don't have that. And then I started going round, and then I brought out the ones that supposedly had issues that were really nothing. And I put them and I said, these are the only things that are wrong with me. And even at that, by the stripes of Jesus, I've been made whole. So I started speaking to myself from that day. Now, I have this older friend also that called me one day, and she said something. She said, as a man thinketh in his heart, so is he. So I started asking myself, what are you thinking? Babe, what are you telling yourself? First things first, my husband told me, don't go to Google anymore. Google is not your friend right now. And it's not everything on Google that is true. So what is true is God's word. So what has God said? So we had to create a space by our dining that we called our wall of promise. And we kept scriptures there, different scriptures with long life. The Lord will start. If I even had a bag, in that bag was like I used to call it my drug bag. I had all kinds of medication in that bag, and went to a photo studio, went online, downloaded the picture that says, with long life the Lord satisfies me, that particular scripture in Psalm 91. And I printed it out and I put it inside that drug bag. So I had the word and I had the drugs. But I was still afraid. I formed the habit of speaking in tongues in the car when I'm driving. Even if somebody was there with me, I would just speak in tongues, and everybody that knew what I was going through, close family members and friends, everybody understood that sometimes we can be gisting in the car and you just lose me because I'm there but I'm not there. And then I'll be checking my pulse and I'll be checking my heart and I'll be checking if I'm okay, and then I'll remember that I should speak in tongues. And gradually I noticed that I could drive short distances alone. I noticed I could stay at home for short times alone, and then I started building up from there. I noticed that the cardiologist started lowering the drugs, and gradually he weaned me out of it. And it's been 2 years. 2 years now. I'm not on antihypertensives. My blood pressure has been stable and fine. My son is grown. This is 4 years later, and I'm not where I thought, where I would want to be, but I'm definitely not where I started from. I don't have those fears anymore. I can drive alone. I can stay in the house alone. I sleep at night. I wake up in the morning and I'm fine. I'm fine. I don't dwell on Google anymore. I don't do that because I now understand that anything that can trigger fear, trigger panic, you don't need it. So what do? I feed on God's word. I stay around people that tell me the right things. I have people that understand that, some information are not necessary. If I don't need to know, then I don't want to know. But even when I hear such things, I just tell myself there's always a word. There's always a word for everything that happens. People are afraid, there's coronavirus, people are dying. But the doctors have told us what to do. But above all, we have God's word. God's word has told us, given us different promises, So I go into the scripture and I look for a word for that season. I try to renew my mind all the time. I try to renew my mind. I look for something God has said concerning this thing, and I just hold on to it. And somehow I have been able to walk through this dark valley, and I'm out of it.
Wow, what a story. People do go through stuff, I told you earlier that we'll be talking about unmasking anxiety. And I have with me our guest for today, a medical practitioner, like I said 2 weeks ago, a bright mind. Welcome with me, Dr. Emeka Kanebi.
Thank you, sir. It's a privilege to be here. Thank you so much.
Thank you very much, Doctor. And by the way, our viewers were really glad with your session 2 weeks ago. Thank you very much for obliging us. A very busy man to have you. Now we'll delve right into our story today, but let me remind you that you can share the page, you can create watch parties, subscribe to our YouTube page, just broadcast this, let the message go out, because it just may help somebody. Thank you very much. Okay, so Doctor, you just listened to to the story, and we spoke about this some time ago.
Yeah.
Now I'm looking at one of the questions you had asked her is how did you know that this was anxiety disorder, an anxiety disorder, because several things could have been happening. So at what point will somebody know that they are dealing with an anxiety disorder?
Thank you so much, sir. It's actually very important, because you need to know, when do I need to get help, you know, and it's not just the regular. So like I said, anxiety it's a regular emotion, you know, it's a normal emotion. You know, if you want to take a test, for example, you know, or if you're going to propose to a lady, these are just these are just normal emotions that happen. That
you want to ask your boss for a salary raise.
Exactly. So these are emotions that are really trigger some form of, you know, anxiety. Some, you know, you're anxious, you're panicked a little, you know, your heart's racing and all of that. But that's normal. It's usually not sustained. So where you have these symptoms of the things I've mentioned, you know, sweaty palms, palpitations, you know, you're not being able to breathe properly, and it's sustained, and there's this intense worry and fear, and it begins to, hear this now, affect your daily life, your regular activities. You know you're in the tipping point. You are crossing that level of, okay, I have a grip on this anxiety, I have a grip of this, it will soon end. But if it remains and is sustained and it's affecting your normal daily existence, your normal daily activities, then you're at that point where you need to get some help.
Yeah. Listening to you, I'm thinking of what our guest said about it's like our life basically shut down. It was affecting our work. It was affecting our family. At some point, she even told us that her son looked at her and said, "Mommy, something is wrong. You are just no longer yourself again." You know, that's interesting. Okay, now she told us that you know, what she was dealing with was a postpartum anxiety disorder. You know, and somebody who is a guy, that's related to pregnancy, right?
Yes, it is.
So a guy is wondering, well, I will never be pregnant. You know, I'm not a woman. Maybe I don't deal with anxiety. You know, are there other types of anxieties that people deal with, anxiety disorders, I mean, that people deal with?
Oh, definitely. In fact, it's good that you mentioned that this was a postpartum anxiety disorder. They're just coming into light. A lot of people are familiar more with postpartum depression. People are familiar with the postpartum blues, but not really postpartum anxiety disorders. And we'll talk about that. But yes, there are other forms of anxiety disorders. You know, more commonly the ones we're all familiar with are the phobias. You know, people have a phobia for flying, you have a phobia for water, some people have a phobia for insects, and some rodents like rats. You know, I know somebody who is really
arachnophobia.
Exactly, spiders. You know, people just can't stand anything with very tiny legs. And then you have those generalized anxiety disorders. You know, so they are more pervasive. Nothing really specific triggers it. They're just a multitude of things that could just get you to that tipping point. And then you have the more regular, some form of anxiety, but it's a bit different in sense as a social anxiety disorder. You know, so it's very critical that we're able to distinguish, okay, what am I dealing with here? Because the way the approach to this will be varied, and it will depend on different factors.
Yeah, talking about the social anxiety disorder, will that be people who are so excessively concerned about other people's opinions about them? How will I look? What will they say about me? And then it gets to a point where they actually can just freeze. You know, they don't get anything done because...
It's so interesting you said this, and I know that sometimes, I remember in medical school, when you start talking about symptoms of diseases, you're almost like experiencing it, and you start thinking, do I have this? Do I have that? So, you know, a lot of people right now are very concerned about this. You know, like I put a picture picture on social media, how many people like it? I make a comment, how many people like it? Somebody made a comment about me, how do I feel about it? And it makes people a little anxious. But remember what I said earlier, before it to be termed a disorder, it needs to start affecting your normal daily activity. So you can't sleep over it. You can't eat. You can't eat over it. You can't go to work. There's so much fear of what people would say, of what people would do. It affects your image and how you perceive life and the world and how you experience it. At that point, you now know it's turning into disorder. Beyond that, it's just a basic anxiety that everybody would face.
Okay, thank you, doctor. So this relates to just about everybody. So you need to
involved.
Listen. Yes, you need to listen in. Now, listening to our guest, she got to a point, she was checking her BP every day.
Yes.
Yes, of course, there was a time her BP spiked.
Yes.
But she was checking her BP every day. But the one that really got me, she was checking her palpitation. She was actually counting her pulse.
So what you see there, sir, is really, that's, like I said, it's where it becomes excessive, it becomes overwhelming. You now know that I'm doing things, I'm being irrational about certain things. So surprisingly, some of these anxiety symptoms, or most of them, would actually come as a raise in blood pressure. So some people who are currently dealing with hypertension for some sort, is actually secondary to anxiety disorders, which is very interesting. But the amazing thing is that sometimes even the amount of drugs you take for that kind of hypertension might never really abate it, because you're going to keep seeing that spike. That spike will keep rising, and that's why people say, oh, I'm stressed or something, because you're still going to have that spike. And with each spike, it gets you even more worried, because you're wondering, you're like, so it just becomes like a ripple effect. And so it becomes a cycle. I'm having anxiety disorders, I'm having anxiety symptoms, my blood pressure rises secondary to what it's happening, the trigger. But the thing is that the more I see that
a vicious cycle begins.
A vicious cycle begins, because I see that spike, and then I'm more worried, I'm more afraid, I'm checking, like what we watched, I'm checking the videos, I'm listening to all the bad things that can happen. This just then spikes this further, and then I have this vicious cycle, and it could actually lead to death.
Okay. Awesome. Looking at triggers, because I know that, like they say, nothing just happens.
Nothing just happens.
Now, looking at her experience, she said that after she had a child, the child had to be detained in a hospital for obvious reasons.
Yes.
And she sat there every day. She was seeing, stillbirths, mothers going on without their babies, babies living and mothers not making it, other patients dying. And that just triggered something in her. And then to compound that was the nurse that said to her that, Madam, I think you have eclampsia.
Yes.
So could those have been the trigger?
In fact, that's an excellent submission there, an excellent point you've made. And we need to look out for these things. And you also, as a person, as an individual, you need to ask yourself, what are my triggers? What are the things that concern me? So in the woman on the video, it could be very, very interesting that the things that matter to her are things that relating to family, children, worry of health, so once that is, and unfortunately the way the world is, that's what comes to you, that's what attacks you. For some people it's money, so money is their trigger. So I have a loss of job, or my finance, like what's happening right now with the pandemic, and all of a sudden that's their trigger. For another person is a relationship, and I just end the relationship, and all of a sudden that's my trigger. I just spiral into this. So for her, yes, it could have been health, but these were very strong triggers. If you remember in the video we just watched, she used the word called climbing. So it was like this thing just kept adding up. So we also need to watch for that. So there's one thing, all of a sudden, she's worried about something. Oh, I can't feel my baby move. What has made her think that? And then all of a sudden, it's real. I can't feel my baby moving. And then that you go to the hospital and they say, oh, we have to have a cesarean section. And then, another thing. So it climbs. Oh, you're supposed to go home, but your BP is up. Why is my BP up? And so all of this, it's a build-up. And then somebody comes and says, this is the worst I've never seen this before. And this also I'm just speaking to other people out there, healthcare workers, healthcare professionals.
I wanted to talk about that.
Yes.
I wanted to ask what that nurse did. Was that properly communicated?
So exactly, and we need to really work on our attitudes, our communication skills, because you never know who the client you're dealing with. We just need to be very clear. It's not lying to a client, but the way it's presented, you can actually do more harm than good. So just to check on that, so just to ensure that we're saying the right things at the right time to the right people. Yes.
Okay, now you have talked about some of the symptoms, and because I'm trying to make this as accommodating, as wide, far-reaching as possible. Talking about the symptoms, you had mentioned something about sleep disorder.
Yes.
And that really struck a chord with me. I know you mentioned that the last time you were here.
Yes.
And as you mentioned something about having enough sleep for building mental stamina, I knew I was guilty somewhere there. But as I thought about this, I was asking myself, is sleep disorder a symptom of anxiety disorder, or can it be a trigger? Can it be a trigger? Because recently, I like I said, I'm a bat.
Yeah.
So at 1 a.m. I'm posting something or sending a message, and people are responding. I put something on Facebook like 2 a.m. and I'm seeing likes and comments, and I'm like, people are not sleeping again. Maybe the lockdown has messed up their sleeping pattern.
Exactly.
Are we going to see a spike in anxiety disorder after this?
In fact, we will. The problem, what I'm worried about is, are we going to pick them up? That's the thing. So they're going to be there, they're going to be docile. You see the report from the College of Medicine, that's just a little. When you see those estimates, they're actually far more than that. So these are the numbers that we'll be able to pick up. How much more are there, especially with the things that are ongoing at the times. Talking about the sleep disorders and how they could actually be a symptom and as well be a trigger. Talking about still those cycles. Because if right now I'm working from home, my sleep pattern could be really, messed up sort of. So that circadian rhythm, I know it's day, I should be up, and it's night. I could actually
What's rhythm?
Circadian rhythm. It just means a time rhythm. Okay. All right. So if it's daylight, I'm just accustomed, and that's what you see with the jet lag. I'm accustomed to be up when it's day, and I'm accustomed to rest when it's night. But if for any reason anything happens that changes that, it just now messes my rhythm up, and that could actually make me anxious depending on what my schedule is following. So for example, I know I have to study for an exam. I'm already anxious about that. I failed this exam more than 2 times, and now I have to write it again. Something tells me push the limit into the day. Once I'm going to bed, I'm going to have this very, very uneasiness about me, which could affect my sleep, because I know, what if I don't wake up on time? So those are the things that could actually be a trigger to increase anxiety. And it could be a symptom because I'm going to worry, I'm going to be fearful, there's an impending doom, and there's no way I'm going to get some sleep.
Doctor, maybe I should be the one answering this question, but let me attempt to ask you. Why do you think we should be doing what we are doing now?
It's actually apt that this is happening because it's timely, and 2, it's very pervasive. By that I mean it affects everybody, especially even the young people these days. The world as we know it has changed. The things we're concerned about, the things we're worried about, I wouldn't say they've changed. We just added more because the things that we used
to... There's a lot of pressure. The other day, my teenage son wanted a particular kind of phone, and I was wondering, when I was his age, was that my bother?
Was that your
I wanted to go outside and play soccer or something.
So for anybody, people who have been in, who have obviously lived that long would know that the worries now have multiplied, in a very progressive manner, in the sense that we need to be very careful of our mental health. And that's why and I'm very grateful to you and your management for bringing this, to light, because it's going unnoticed, because it wasn't a thing before, but right now we're seeing a lot of this. There's some of the cases that come to the clinics these days that we think are, when I say organic causes, we think something is causing it that is, environmental or something. We're seeing that more and more. A lot of the overt cases we're seeing are secondary to some mental disorders as well. And so bringing this to the light, a lot of health professionals are now actually having a bigger eye, wider eye, so they ensure that they're able to identify cases early and then make sure that the appropriate treatment is given to people. I think it's very essential, very essential.
So, doctor, this is Nigeria, talking in about Nigerian context. Just sometime this week or just last week, I think last week, the finance minister said inflation rate has gone to 12.34. And I just know, if I had to do a short video to encourage people, because I know that will cost many people's heart to beat. So does a sense of what tomorrow holds create anxiety? The uncertainty that's in, what am I going to do? You know, what import does that have?
It's actually interesting, sir, that you brought this up, because it just brings to bear what I wanted to talk about the last time, where I said that, you know, to a woman in the village, when you mention the inflation rate, or she sees in the headlines, or someone tells her it's 12, it doesn't mean so much to her, you know, so it wouldn't have so much of an impact as regards somebody who works in a financial institution. That, for example, could just mean that the world is crashing down. So again, depending on your trigger, depending on what matters to you, that could actually be, you know, put side by side with what your level of anxiety could be, what your level of anxiety could be. So that is very, very critical when you're talking about triggers. What matters to you, its impact on you,
on your business, on your family,
business, on your family, on your what matters to you. What is it very evasive, coming too close to home, like people would say? Is that what gets to you? And you have to really put those guards to ensure, because you never know, you just never know what gets you to your tipping point.
Wow.
Yeah.
Okay, so when we spoke to our guest, she said that she grew up understanding that every voice has a significance. There's something to every voice. So now we just spoke about the voice of inflation.
Yes.
Every voice has a significance. And she got to a point that she said she was hearing voices that also would say to her, just end it. Just end it. You're going to not make it. You know, and then she got to a point she was worried, is my children's heart still beating? What am I going to leave my children for?
Exactly.
And all of that. Will that be an extreme case? Is that common with all anxiety disorders, or is there a point it gets to? And
I'm really thankful that, you know, that she's talking about it now in the form of I've overcome this. But it was at that point, that was, my heart even sank in myself, because I know that is a point of despair. And like I mentioned, once you almost start delving into a point of depression. You just start slipping, and then from there you start having the suicidal thoughts. You know, you start having I'm incapable of dealing with this stress. I'm incapable of dealing with what is happening in my environment. So when you start hearing those voices, sometimes if you're not careful, these could actually be hallucinations. And once you start getting to that point, you might be delving into psychotic symptoms. And that's why you see the overt, this person has, you know, moved from an anxiety disorder, and it's a spectrum. So I'm coming from just, you know, normal worries, and then there's a trigger. And then, you know, she kept mentioning this, it's climbing, and it's sustained, and it persists. All of a sudden I get into an anxiety disorder. An anxiety disorder wanes, and it starts affecting my daily life, my daily activities, and also then I'm now sad. It's affecting everything around me, and then the sadness is sustained, and I enter depression. And my depression is so sad, it's affecting everything around me. People I feel I'm worthless, I feel this is hopeless, I've not seen any improvement, and then the voices start. And sometimes it gets to a psychotic break, a psychotic impact, and then I'm schizophrenic, I'm schizodepressive, or I end up just being messed up, and then the next thing you hear is suicidal thoughts. I'm taking things to numb the pain, I'm taking things to numb the thoughts, and then death.
She said something. She said that, and that really got to me, that it got so bad, she just kept, in fact, she kept going to the doctors. Something is wrong with me. Tell me. They'll say, madam, you are fine. Something is wrong with me. And then she got to a point, whenever her husband traveled, he got this gadget to check your BP, to check this, to check that, because there just must be, you know, something wrong. So, at what point do you know that concern has crossed over to anxiety? So it's good to be concerned about your health and how you're doing. At what point do you know that, no, this has
gone beyond?
Yes, you know, that's one, doctor. That's one. So that is in the health regard. Another thing, listening to her, is that and she also admitted to that, you know, that streak of perfectionism. I want things to be done right. I want things to go well. I want my children to be in a certain way, my house to be in a certain way, my car to be washed in a particular way. And then it looks so good, but then at a time comes, you just get so fixated, you know, so finicky on things that you don't even know when you have crossed. So when will I know I've crossed the line?
I think, thank you again.
Yeah.
This is very interesting. And you know, I'm sure a lot of people have heard of the obsessive compulsive disorder.
Yeah.
And, you know, that used to be, you know, classified
OCD.
under, yes, OCD as people popularly call it. It used to actually be classified, you know, under the DSM as an anxiety disorder, but it's been taking out of that actually because it had some form of very similar symptoms. In that regard, what happens is that you discover, I think this is one of those ailments or illnesses that your best marker are the people around you. You know, they're the first people that say, hey, this is no, this is too much. And you should actually listen to that, especially when multiple people are saying, hey, you're cleaning too much. Oh, you know, maybe somebody, regular things. So somebody would usually, people came to their home, they'll probably wait till they go and then they clean up. But the people are still there. And you're cleaning.
You think they should go and dust it?
You go and you come back and then you clean. You know, I'm having a conversation with you and like, oh, you know what? You clean something, or you know, I clean this and try to get it straight. At that point, even people around you start telling you, you have to watch it. You know, affecting your life. It's another critical. Your regular. So I know people who imagine that the gas burner is on all the time. The stove is on. So they're sleeping, but they wake up in the middle of the night and say, did I turn? I can smell it. And they go back and they turn. Or if, you know, or for example, you're laughing because maybe you know somebody close or you're one of those people.
Let's not talk about it. Let's go on.
Let's not go so close. You know, or people just keep checking if the doors are locked. And sometimes these could actually be a fallout of a previous experience, perhaps a robbery. And so all of a sudden there's a dent that makes
Sorry to interrupt you. So it's just that we have to put in so much in so little a time.
Yes.
Talking about the previous experience, because that was also of a concern to us.
Yeah.
You know, and at some point our guest told us that there was an illness and a death in her family while she was growing up.
Exactly.
You know, so, and then in the hospital she was seeing death all around. So so there was a trigger while she was younger.
Yes.
But then she lived somewhat of a normal life, and then something triggered it.
Yes.
You know, did one go to the back burner? Did the first experience?
Yeah.
You know, what part did it have to play? Which was the bigger trigger?
What is the circuit like?
Yes.
Exactly. So it determining what actually was that, you know, link is actually less important as detecting what is my current trigger.
Okay.
You know, what is adding.
Well, I asked that is that a predisposer?
It could, yes.
Because if that hadn't happened, could she have handled the hospital experience better?
Definitely. So now, thanks for bringing this up, because there are things that contribute to the way I actually lean towards an anxiety disorder or how I handle it.
Yeah.
So for example, you know, we talked about this even when we were talking about stress and dealing with stress.
Yeah.
And I talked about the genetic component, your makeup, because all of that. So we do know that anxiety disorders actually run in families. So if I have in my family some form of alteration in my genetic makeup, and that's a very important thing about the genes, I could actually be predisposed to having an anxiety disorder. Secondly, just like what we talked about, previous experiences in life, these things are all contributory to an anxiety disorder. So for example, a woman who has had maybe issues during her menses, emotional swings, is very likely to have, because those emotional hormonal changes would happen in pregnancy. So you can actually have that tilt. And then what maybe makes me tilt to an anxiety disorder or stay on course or stay in course is because of perhaps that genetic predisposition. So it's very synergistic, you know, so it's one thing adding on to another, and then also the kind of support around you. So if I have somebody who's telling you you're crazy, you know what, it could actually tilt me further. And also, how am I dealing with with our guests? You see that things were adding up. So I can't feel my baby moving. It's a fear. It's a very normal fear. You have to have a cesarean, something must be wrong. Why am I not just having this baby? Oh, no, not just that. Your BP is up. Why do I have that? So it keeps adding up, and then that could actually increase the gravity of the effect of whatever trigger might come subsequently.
Okay, thank you, doctor. You know, I must say at this point that because of time also, when you begin to notice that the people around you are getting edgy, they're not comfortable around you, are always finding fault in something everybody does all the time. You know, you are becoming just very, people find it very uncomfortable difficult to live with.
Yeah.
You know, then you need to begin to pause and look.
Exactly.
And look, you know,
Exactly.
and need to begin to introspect.
Exactly.
And that takes me to, can you fight this? In our story, she had gone to a particular specialist doctor who had told her that, Madam, from all your tests, I don't think anything is wrong with you.
Yeah.
You know, and then her boss also told her, Madam, you need to fight this thing. At what point would you say you need medical help, and at what point can you fight it, or can you fight it all the way?
I honestly think that if you've fallen into an anxiety disorder, at that point, once it becomes a disorder, I say you need professional help. Now, don't get me wrong, I'm not saying there are people who can muster this inner fight and strength within them, and then, you know, people are different, but I would say play on the side of caution. You know, so we talked about maladaptive ways of dealing with stuff. So some people feel that the way they're handling their anxiety disorder or their stress currently is actually they're handling it, but what they're doing is that they're delving further into another thing. So they think, I'm coping with an anxiety disorder, and they go off to the bottle, you know, or they go on to drugs, or, you know, they go on to a maladaptive behavior. So I think that help immediately becomes you identify it as a disorder, you need help, and it doesn't have to be
if I'm dealing with an anxiety disorder, will I have the capacity to know that I'm dealing with it? Because you said the moment I identify, I was sharing a joke with you about a guy who believed that he was dead. He's living, but he believes he was a dead man, you know, and so the wife was like, "You are living your life." I said, "No, I'm dead. I'm dead. I'm dead. I'm a dead man." So the wife took him to professionals, to doctors, and their primary assignment was to just convince him that he was alive. You know, so they brought out charts and PowerPoint presentations, videos, and all of that, just to prove to him, simple, they just wanted to prove to him that only living things bleed. Only living things bleed. So they showed him videos and all of that. And after that, they said, repeat it after us. Only living things bleed, only living, he said that like 20 times. And they brought a needle and pricked his finger, and then blood started coming out. I said, so what do you think? He said, wow, that means even dead people bleed too.
Wow, this is new.
So he still believes that he's... So I'm saying that, would you have the capacity to know that I am borderline, or I've crossed the line altogether?
You know, it's interesting you'd ask that, because that gives you, there are different kinds of people. So you have those people, like you're saying, you realize people, so you might not think the problem is with you, but you see how people are reacting to your new behavior or recent changes with yourself. So that's one. Two, you probably will not find out yourself. So like I said, because anxiety disorders would manifest in some form of somatic, you know, I mean by something that we can see, like a rise in blood pressure, like breathlessness, you would eventually push yourself to a point of going to seek medical help for what you think is an organic cause, and then all of a sudden you keep hearing, there's nothing wrong with you. There's nothing wrong with you. At that point, a smart physician, and again, speaking to our health workers again, we need to start having this very huge index of suspicion. You see a client, you've done everything for them. They keep complaining, because I had a client like that. Headaches, headaches, headaches. You've done everything, you've done your CT scan, you've done everything in the books, and then these headaches are still persisting. You need to start thinking, is this lady depressed? Is this man, having an anxiety disorder? Could I be dealing with something not organic? Because these are becoming more prominent, especially in the times we're living. So I just thought to, chip that in there, so that, so you have this complete, comprehensive care, and that is client-centered to your patients. I think that is very, very essential. More and more, this is coming up, and I'm sure that, the number of cases we're going to see is just going to, keep coming up, and then we're going to have better solutions. So that's very important. You identifying yourself, because things around you are changing, people are telling you things, and then two, you presenting to a health facility with somatic symptoms, with just symptoms of, that are regular, indicating that you have some other organic cause, and then you ruling that out and discovering that, something else is wrong. And just to chip in, sorry, I had just to make, the story you told, which is very interesting, that is one of the fastest ways to get people to even become more ill. Trying to convince somebody that what they believe, even if it's a delusion, is not real. You actually push them further. A better approach, and that's a lot when you talk about cognitive behavioral therapy and psychotherapy, is actually trying to find out why they believe that.
What they believe.
You will be so amazed at what you're going to see. Even for you, you can actually do that right now and ask yourself that some of the fears you have, don't mind people who tell you they're irrational. For you, they're justified. But you need to ask yourself, why do I believe what I believe? I think that's a good one, yeah.
Thank you, doctor.
Yeah.
Support system. I listened to all she went through, and I don't think the video even did justice to that.
No.
And I'm wondering, how did her husband cope? Because I know many people will have just left. Because sometimes the natural thing is to run away from what we don't understand.
Exactly.
What is becoming difficult to manage, and so I'm wondering, if I have, so I commend her husband. I commend her husband and her brother that was also there for her.
Brother as well.
So I'm wondering, just to help somebody, so if I'm living with somebody that's maybe showing signs of anxiety disorder, how can I be a strong support system for them? How can I be that go-to person, as at least before the professional help?
I think you're a very smart man. Your questions are really, really on point, and that's very good.
My FIFA rating. You just boosted my FIFA rating.
Because I think your questions come with I think it's also the pastor in you, because it's more of how do I get to help people ultimately. And that's how we all have to think. Because I'm sure the earlier part of this discussion, you're thinking, I know someone like that. No wonder they have a problem, and that's what adds to the stigma. But if we start having an attitude of, I want to help. I know somebody with this, but how can I help? Because they need, and like you said, the social support, it's actually very key in managing this client. And so how do I be that strength? How do I be that person? First of all, is not feeding that, it's not feeding or actually condemning or criticizing. The first thing is just say, you know what, and sometimes just identifying that I understand, and your fears are rational. You don't talk them down. You don't tell them, what, this thing you're saying doesn't make sense. I don't believe it. Or, what's wrong with you? Are you mad? People use those words, and actually those are more condescending, and it actually makes these people become recluse. So this person decides to isolate, not in a good way, but just decides to isolate, stay away from the world. Nobody understands me.
And they might now go into drugs and all of that.
Exactly. Nobody understands me. Nobody gets it. Everybody feels I'm crazy, and that's the first step of losing people. Sometimes I also tell people, if you don't have even that support, if you don't have that capacity, it's better not to say anything. I know people, and we also push for that, even when it comes to health professionals again. When you're dealing with a case that you don't know what to do, the next thing to do is to actually refer the client. So I don't know what to do. You can actually say, okay, what else can I, and you can do something, and that's actually provide help for somebody, link that person to a social support group, call a pastor if you know, or somebody
that already, you started answering my next question, which is about, as we round up, can it be treated? Anxiety disorder.
Yes.
Is it
thankfully
through medication or what? How can it be treated? And I'm asking that because somebody is afraid to go there, because especially if it begins to look like, I have to see a psychiatric doctor. Somebody's like, if I have to go to see a psychiatrist, it may appear to be like something is wrong with me. Can you allay people's fears? Is it treatable? Is it okay to come out and say, I'm dealing with this, and get help?
I think it's just like what we're dealing with even with the pandemic. It's the stigma, all right? So there's the stigma shrouding mental illnesses. Trust me, it's pervasive, it's everywhere. Every country has that. Once I'm seeking, like even the words, you just say, I'm seeing a shrink. That's a problem. I have to see, even now it's spilling into psychologists. I'm seeing a psychologist, or my child is seeing a child psychologist. What is wrong with him? Or my wife is seeing a psychiatrist. It just denote something as bad. But you know the amazing thing, these are just health. They're actually just supposed to support you. And like I told you, the amazing thing is that it's not just the overt, what we call madness, it's more of a schizophrenia, but that's the name. But people see overt of people stripping down and, shouting and the psychotic symptoms. There are other mental illnesses that don't even present like that, like the OCD and these anxiety disorders we're talking about, depression. The important thing is getting help. And talking about treatment, what happens sometimes is that there are multiple treatment modalities, but what you see most of the time is that somebody or a health worker leans towards a particular one, and that is the one that makes people feel that they are mad. So for example, if you lean towards pharmacotherapy, meaning the use of drugs, medication, it just means that, something is wrong with you, you're taking drugs and these drugs would numb you and all of that. And I tell people, you don't just use one modality to treat people who have mental illnesses. You have several modalities. Another is the psychotherapy, where you have cognitive behavioral therapy, and I keep mentioning that because it's big, where I'm trying to work on the person's mind. So I'm giving you a drug to help you, and that's doing several things. I don't want you to tip into being suicidal. I don't want you to hurt your family. I don't want you to hurt your child. I don't want you to hurt yourself. So I give you something to ensure that doesn't happen. It boosts, so we have some of them called mood stabilizers. And so that boosts your mood or helps you sleep. I do all of that, but I don't just leave you. I don't just give you a 3-month supply and say, bye, go lucky and all of that.
Combination therapy.
It's a combination therapy. That's excellent. And I have to have that psychotherapy aspect to it combined with the pharmacotherapy. And sometimes even the psychotherapy alone does the job. And sometimes it might not come in a professional point. Like if you remember in the video, she kept mentioning, the things that were said to her. My husband would say this to me. And these are the things that stay in her mind. The old woman she encountered.
At the hospital.
At the hospital,
said, you can't go down this way, fight it, stand up. You're too young to do this. And all of a sudden, you snap back and start saying, why am I thinking like that? And some of the actions she had to take, which were personal, she had to come to reality. Oh my God, I've done, 14 tests. Wow, and being thankful. We talked about that, appreciating life. Wow, I thank God I don't have this. Thank God I don't have this. Oh, I have this. Oh, this is treatable. And so she began to interpret her feeling by reality. The test says I'm fine. So no matter how I feel, I am fine.
I'm fine.
It says my heart is okay. My heart is okay. No matter what my mind says.
And it brings things to perspective. So you see that, oh my God, I'm actually being irrational. And one thing that is also very important, and I must say this, is that you might never totally deal with it. If you remember, and that was one interesting thing about the story. She says that I still get anxious, I still have this, but I still sometimes feel the need to check it. It's a work in progress.
I've reduced my going to Google.
Exactly.
I reduce exposure to the triggers.
Exactly.
I watch what I hear, what I listen to.
What am I feeding myself with? Because these are the things that occupy my mind and allow me to delve into areas I'm not supposed to go to.
By the way, this is also going on audio stream, and it will still be available to watch on YouTube, on Facebook. You can come back and listen on Mixlr. The audio file will be there for you to listen to and share with your friends. We are doing this just to be a source of help to people. Remember, you can ask questions, and if we don't answer them immediately, we'll still answer them. We can actually even inbox them to you. You can inbox them to me. I will get them across to doctor, and we can also answer that and get your answers across to you. Today, we've spent time with Doctor again on masking anxiety disorder, that is, and I know it's been an enjoyable time. I want to thank you for being a part of today's edition of Safe Space with Pastor Wale Afelumo. I want to thank our guests, our anonymous guests, but with a very real story, the very real story. And I hope that somebody will have a documentary on that story. And I also want to thank our ever intelligent, bright Dr. Emeka Kanebi. Thank you very much for being on our program today. I want to thank our crew, the people on the camera, our sound guys. Thank you very much. We appreciate you. I want you to have an amazing remainder of your Saturday, and God bless you. You matter to God. This is Pastor Wale Afelumo. Bye.